Holly Martino has been complaining about little spider veins here and there on the back of her legs forever. And of course, she heard about Dr. Tahl Humes on my show, and she says, hey, can you do this? And Dr. Humes is the founder of Vitahl Medical Aesthetics in Cherry Creek. It's a medical spa that's more than fluffing hair and applying cream.
Yes, it's much more.
You have lasers for everything.
We do. Yeah, we have lasers that treat the skin, that treat the veins, pretty much everything.
And one nice thing is I've gone to other spas to try to get the veins removed, and they can get the red ones or they can get the blue ones, but they don't have machines that can hit all of them in one treatment.
Now, why is that?
It's kind of a pain. You don't want to have to go here and there. Yeah. Or they bring it in one day, you know, during the week.
So why different colors? I don't understand what she said. Some lasers can only treat certain veins, and yours treats all of them?
Ours can go deep enough to get even the deep blue veins. So what'll happen is sometimes...
Yes?
You remember those?
Yeah.
So can we take a look at... Do we have a video of Holly having this treatment done? Because, okay, so those are the little red ones, right?
Yes. And Holly has very minor veins. I know they bother her, but you actually have beautiful legs with very few veins.
So then what do? You do... That's it, right there. Yeah. Now, does that hurt, Holly?
You know, it stung a little bit, but the head of this laser thing here is cold. So she gets it cold first and then zaps it.
So it stings a
little.
So, I
mean, it stings a little bit. Of course, it's a laser, but it's not.
You can, but the numbing cream really only helps superficially. So what you feel is you feel the laser going deeper, and Holly can tell you when you go after those deeper blue veins, you feel it a little bit more.
Like, woohoo! Right.
Yeah. Now, this is a great time to have this done, and why, women?
You're going to watch this vein actually go away. Oh, they switched off of it. You could actually see it when she hit it go away. Okay, and why, again, why is this a great time? Because you don't wear bathing suits that much. You're not really exposed that much. Is that why most people want it done in the winter?
Exactly.
Because you have a little reddening after? There's
some reddening afterwards. There is a risk of bruising because we are dealing with a vein. So it's a great time to do it. It is something where you, some people may need multiple treatments. We expect that most people will need 2 to 3 treatments. So it's a nice time to get it started now. One, if you're going away on a cruise for the holidays, let's say.
Oh, cool.
Now you've done a treatment. Or if you want to get ready for summer, you know, bathing suit and shorts season, you're starting now.
Yeah, definitely start now.
You're a doctor. Why did these happen?
Why did these happen? High pressure.
Look at some of these good before and after pictures.
Yeah.
Wow.
This is great. These are not Holly's legs. This somebody has more extensive veins than Holly. But I thought it was a great picture to be able to see the before and after because Holly's still healing from hers.
Okay, now, do you keep... Can you go, you say multiple treatments, how far in between? About
6 weeks in between for the bigger veins. You can go 4 weeks if you're doing veins on the face, but on the legs, which are going to be bigger veins, we usually like to wait 6 weeks.
All right, and what about other forms of skin damage that you can do with a laser? Can you do sun damage?
You can. So, for example, small veins on the face are actually a form of sun damage, so you can treat those in the winter. You can also go after some of the brown spots with something like an IPL photofacial if you wanted to have no downtime, or the pearl laser, which we've talked about before, which we did on Paula at one point, which will resurface the skin and also take care of the browns.
For most of these laser treatments, are we talking about a long time in between? Like, can you be ready for the holidays now, for Christmas, New Year's?
Yeah, and I also wanted to mention that men also go in and have them done, especially for the veins on the noses and stuff. Men go in and get those taken care of.
Now, I really want to say this. What if somebody had a life of drinking and you know how they get veiny? Can it help?
It can help if they continue to drink or if they're, you know...
Well, yes, the lifestyle,
then they're going to come back.
But you actually can help people because a lot of people, they've given up drinking, but they still look terrible. Seriously. So you can actually treat the face with this.
You can. Yeah, we see great results on the face.
And so what would a person look like after, let's say, a nose or face treatment?
Well, it depends on how extensive their veins are. You can look bruised. You can look a little bit beat up. But for the most part, the smaller the vein, the smaller the bruise. So we see the bigger bruises are going to be on your legs where it's a larger vein, whereas on the face, they're going to be smaller bruises. And usually you can cover them with makeup. I know men don't love to wear makeup, but they could if they needed to.
And I know Holly loved your spa.
Oh, yeah, it is so beautiful. It's very welcoming. I loved your spa. It felt great.
You do the full line of medical treatments. Full line of medical treatments. You do injectables.
We do.
You do all kinds of facials, all kinds of lasers. So that is really good because you go to one place for all of it. Supervised by a doctor.
I do a lot of the treatments as well.
Of course, we saw that. And what I want to know is, if people, they say, well, I might want to have it done, of course you give consultations.
Yeah, we do complimentary consultations. Our goal is to educate each person on the treatments that they're going to do, rather than worrying about whether or not they need to come in and pay for a consultation and make the decision there because they may get their money towards their treatment. We want people to come in, get educated, learn about the treatments, as well as learn about us and our staff.
Second, and Steele, by the way, in Cherry Creek, and here we're seeing Dr. Humes actually do a treatment on Holly. Now, I want to ask you, what is the biggest misconception? What's the biggest misconception about a medical spa or spas in general that would make people not call? What is the biggest misconception? You might be out at a cocktail party talking to friends. What do they think? It's a heavy-duty medical clinic. Is that a misconception?
I think
when you say medical spa?
I think actually what happened is that a lot of people think that medical spas don't have a physician involved. They think that it's a spa that just happens to do these treatments, and maybe there's a physician somewhere. And
they don't really believe it's a medical spa.
Exactly.
Because I think people would want a medical spa.
I think so too. That's why we have a physician on staff. We have a physician on site.
Which is you.
Yes.
And you're there.
Right.
I'm there. And if I'm not, I do have somebody, for the occasional time that I go out of town, there's somebody who covers for me.
And there's a lot of medical spas out there that they just have a doctor that they answer to that's not on site. And, I think that's where people run into problems.
Exactly, and you want to know, these are medical treatments, there are complications that can be had, luckily not very severe ones, but you want to know that they can be taken care of, and they can be taken care of quickly if anything were to occur.
If anyone has any questions, by the way, we can see if Dr. Humes can stick around for a few minutes. 303 Martino is the number for this and any other segment you hear. Vitahl Medical Aesthetics, Cherry Creek North, 2nd and Steele. 303-388-7380. 303-388-7380. Vitahl.com. That's V-I-T-A-H-L, and that's a play on Dr. Tahl Humes' name. Vitahl.com. Paula?